Welcome to Health Professional Radio. I'm your host, Neil Howard. I'm going to be speaking with Dr. Aaron Katz. He's a chairman of urology at the NYU Winthrop Hospital. He's also professor of urology, NYU School of Medicine. He's joining us to talk about the Oncotype DX Genomic Prostate Score, or the GPS test. Welcome to Health Professional Radio, Dr. Katz.
Well, thank you very much for having me. It's a great pleasure to be with you today. Thank you very much, Neil.
Well, I did, of course, mention that you are chairman of urology at NYU Winthrop and also professor of urology at NYU School of Medicine. A brief background, and then let's talk about this Oncotype DX Genomic Prostate Score as it relates to the AUA 2020 meeting, okay?
Sure thing. So as you mentioned, I'm currently the chairman of the urology department, which is a branch of the NYU School, NYU Langone Health Center. We have three major branches, one in Manhattan, one on Long Island, and one in Brooklyn. And I'm currently the chairman at the Long Island Center. I've been here for just a little over 8 years, and before that I was professor of urology at Columbia University. And my main interest has been in men's health and focusing on prostate cancer, and clearly this is a major health for men in the United States. There will be about 160,000 men diagnosed with prostate cancer each year. It's a main concern for men, not only in the diagnosis, but also the treatment and possible implications for men's health. But I do actually have my own radio show on another station every Sunday morning on WABC and talk about men's health issues as they come up quite a bit for men, not only for prostate issues, sexual issues, urinary issues, and of course the other major issues that men are concerned about, their heart health, their bone health, brain health, nutrition. So this is an area of interest of mine, and it has been for a number of years. And with this new test that we're going to talk about today, which is very exciting for men that have been diagnosed with prostate cancer, it helps both patient and the clinician help to guide different treatment strategies in a new way that we didn't have before, this kind of a DNA testing of the biopsy sampling. So it's a great pleasure to be with you here, and this was presented at the American Urological Association's meeting, and due to the coronavirus pandemic, it had to be done virtually this year for the first time ever, hopefully never again, but has received a great review and a great amount of enthusiasm for the test and its implications.
When you said men who've been diagnosed with this type of cancer, are we talking about late stage, early stage? What type of risk factors are we talking about when using this test, and how accurate is it based on some of those factors?
Yeah, I mean, it's a great question, and there are different stages of any cancer, right? So thankfully today we have the blood test, the PSA test, which is a prostate-specific antigen blood test, which I do encourage all of your male listeners, if you haven't had the test, if you're 50 years and older, that you get the test. And men that are at higher risk for developing prostate cancer are men that are African American, men that have a family history, men that have been down in New York City that were exposed when the World Trade Center buildings went down, as well as men that were served in Vietnam that were exposed to Agent Orange. And because of the PSA testing that we're doing throughout the country, we are seeing men that get diagnosed with a much earlier stage than we had before. And the idea behind the test, the PSA test, is can we get men in an earlier stage, which will also reduce the overall mortality or death rate of prostate cancer, which we have seen significantly over the past 20 years since we've been doing the PSA testing rather routinely. But the men get diagnosed, and you need to have a biopsy. So after you get the blood test, if it is elevated, you need to obviously speak to the urologist to determine whether or not you need a biopsy. But if it is early stage and the biopsy is performed and does confirm prostate cancer, then there's a number of different treatment strategies that we have in the United States. But one of them that we've been using more and more often is active surveillance, which means no radiation, no surgery, and active surveillance monitoring. And the question is, who are best candidates for active surveillance? Who should just be monitored and we just watch their PSA and maybe obtain MRIs yearly or every other year, and not employ definitive treatment like radiation or surgery. And that's where this test really comes in. So it is an important factor for men with early stage prostate cancer, not for late stage, not when the cancer is spread, but when you get the biopsy, if it's early stage, there's no evidence of spread, should you or should you not have treatment? Should you go on to active monitoring? And that's where this Oncotype DX test comes in, and it looks at the individual prostate cells and actually looks at the DNA. Neil, it's a real fascinating test. It can actually get right into the DNA of the cells and give us a score, a new score. We call it the Genomic prostate score, and can determine whether or not these cells are aggressive or not, and gives us a new classification above and beyond the traditional classifications that we were using in the past, and can be very helpful, again, to determining whether or not the patient should go on to treatment or not for men with early-stage prostate cancer, which is the majority of men that get diagnosed in this cancer with prostate cancer, thankfully, and again, because of the PSA, are early stage.
Why is it important to undergo or participate in active surveillance when you're at early stage as opposed to undergoing some type of treatment when it's shown by the test that it's more than likely not necessary?
Yeah, I mean, there have been great advances in the treatment of prostate cancer over the last 10, 15 years. The way that we remove prostates is done robotically now, where patients can be in and out of the hospital within a day with minimal blood loss. The way that we're delivering radiation, and we have a wonderful program here at NYU Winthrop called CyberKnife, which is 5 days of radiation rather than the classical 45 days. But despite that, there are still side effects that men can, develop from either radiation or surgery. And a lot of the studies are showing that in the men that are best suited for active surveillance, and these men that have these low genomic scores with this new test, if they have these low scores, they may not need surgery or radiation, maybe not now, maybe delayed in the future, or maybe not ever. And so we can allow them to live excellent quality of life. So you're basically living with these cancer cells that are not aggressive. They're not going to harm you. And you wouldn't have to undergo radical surgery or radiation. Again, it's not for every man. And sometimes this new Oncotype DX test can tell us where we thought that the cells were not aggressive. Under the microscope, by looking at the DNA, they actually may be more aggressive than what we thought. And so, you're not a good case. A lot of patients will come in to me to see me, and they'll go, Dr. Katz, I don't want to have any treatment. I just want to have active surveillance. Or a program that I started here called Active Holistic Surveillance, where we employ diet and herbal compounds and exercise and things like that. And I'll say, okay, well, let's do the Oncotype DX. Let's see really what your cells look like. And I'll get the test back, and I'll go, you know what? I'll call them or see them back in the office and say, listen, these cells are more aggressive. You're not a good candidate for active monitoring. I think you need to consider some form of treatment, because if you don't, these cells can escape the prostate gland, and they can, and if they do escape and they can go into a lymph node or a bone, that's going to have a major impact on your lifespan. There's no doubt. Early stage localized disease into the prostate won't kill anyone if it's truly localized and it stays there. It's only when it gets out of the prostate and spreads to the lymph nodes in the bone. So that's where this test really can make a big difference.
Doctor, talk about the importance of this test, particularly during this COVID-19 pandemic, and then give our listeners a website where we can learn more.
Well, in terms of the COVID pandemic, and obviously in New York, it was tremendous. I mean, it was something that I had never seen before. Our entire hospital was filled, as most of the hospitals in this region were filled with patients with the virus who are now. And now are still concerned about coming to the physician's office. They're concerned about if they needed surgery, they'd have to be in a hospital. If they needed radiation, they'd have to go to a radiation center or a hospital center where they're going to be exposed to other people. So if this test can give us greater sense of assurance that you don't need to have those treatments. It would obviously help you to socially distance and even if it would spare you for a few years that you wouldn't need definitive treatment. Right, it would give you allow you the ability to say, look, I don't need treatment for a few years now. I don't need to be in a hospital setting or a radiation center. So that's where this test can be very, very helpful. I think if you're interested in learning about this, it's the Oncotype DX, the Genomic Prostate Score. Certainly, people can look that up on the internet and find more information about that. The Genomic Prostate Score (GPS), and I think it's a very useful test. And if you've had a biopsy, and again, this is only for men that have had a biopsy now. So you've had an elevated PSA, you've had the biopsy, and you're unsure whether or not you should go on to treatment. This is the test that you need to have your doctor order for you. It's not a test you can order yourself. You need to have the doctor order it for you. It is covered by the insurance carriers, so that's good. But the doctor and their offices, and most urologists around the country, and in our study, we evaluated 30,000 men that already had this test, 33,000 men to be exact. So most urologists in the country have the ability in their office to get this test ordered. You don't have to have an additional biopsy. That's an advantage. And it will give you unique, individualized information about your specific cancer and help you make that treatment plan in a much more educated way.
Dr. Katz, appreciate you coming on and speaking with us this morning.
Sure. I'm glad to be here, and thank you very much. I greatly appreciate the opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Aaron Katz. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.